All right. Good morning, everyone. It is 10:05. I think that's a good time for us to go ahead and get started. So thank you again for joining us for the second session in our ongoing series on how to center equity in the safety net. Please mute yourself if you are not already. We would love to get questions from you throughout this forum. So please use our chat function as well as the raise your hand function. Um, This morning, we will be having our second session. Our first event was on October 28th. We focused on the cracks in the system that COVID-19 has exposed and ways that public agencies and social change organizations can center equity. This morning, we will focus on how government plays a role in doing the same. We will have that conversation with our president and CEO, Robert Phillips, Anna Gorman, LA County Department of Healthcare Services, of Community Partnerships and Programs, and Marco Michie, the Deputy Secretary, California Health and Human Services, the state of California. Thank you again, and I will turn over to our President and CEO, Robert Phillips.
Thanks, Julia. So before I say a couple things, I wanted to say I'm so pleased to be joined by Anna Gorman and Marco Michie. And just to give a brief background on them, and I'm sure folks can find out more if they'd like, but Anna is the Director of Community Partnerships and Programs for LA County Department of Health Services, and is a partner of Illuma's, as well as we have a direct relationship with the county. She manages that, where among many things, she manages what we support at My Health LA, which is a no-cost health coverage program for uninsured residents in the county who aren't eligible for Medicaid or can't afford covered California plans. But she's also an award-winning journalist who once worked at the LA Times and for Kaiser Health News Service. So we're so happy to have her with us. And then Marco is Deputy Secretary of Program and Fiscal Affairs at California's Health and Human Services Agency. And I won't steal his thunder because you will hear this, but he's someone who has a deep commitment to public service. I mean, you'll hear that shining through in just a moment. But in addition to working at the Health and Human Services Agency, he's also worked for the American Heart Association and the Department of Health and Human Services under the Obama administration. And so before we get into it, and this will be a conversation, not just between myself and Anna and Marco, but hopefully with you all. There's a couple things I want to say by way of context. And so you heard from Tahir, our last conversation was really about, how can we be organizations who work in the safety net that are purposely focused on reconstructing the safety net to be rooted in advancing equity for those who need it, and doing that by amplifying folks' lived experiences, providing trauma-informed care, but also actively naming and addressing the root causes and barriers and navigating safety net system that people can find really, really challenging. Today, though, we're really going to talk about the context in which all of that operates. So today, when we're talking about rebuilding the safety net to address inequity, we're not just discussing how some technology, system, or policy approach has by and large failed to deal with racial and economic inequity. We're going to be talking more about the publicly controlled, publicly funded agencies and organizations and other entities that, use different ways, including technology, to deliver programs and services to the people by, or what we all call in shorthand government. And we are doing that, one, because it's an opportune time to do it. Two, because we at Illuma unequivocally believe government is essential to seeing the changes we want to see in people's lives. And we are unambiguously clear that it's racist. And I don't say that to be pejorative or shocking. I just say that as a matter of historical fact. That from the inception of our country, the levels of government that make up our system of federalism have played a core role in creating and maintaining racial inequity through its ability to enforce and invest in the changes it wanted to see. And because this is Black History Month, I'm going to use the bright light of Black history to run through 130 years of American history, just using 5 policy actions that have shaped how we view the simple idea of help. From mothers' pensions at the inception of our country's safety net in the 1890s that excluded Black women because it interfered with the service and farm economy of the South. Fast forwarding into the 1930s and the New Deal, Roosevelt's Social Security Act in 1935 had farm policies that reinforced the South's sharecropping system and explicitly excluded personal service workers at the South's insistence, which locked out 2/3 of Black workers at the time from unemployment insurance. So 40 years later, Nixon's Family Assistance Plan really actually laying the groundwork and encouraging the rise of Reagan's welfare queen narrative in the 80s, which gave way to the Clinton administration's racialized welfare and workfare programs in 96, which restarted the poverty trends we see today, and that's driving the inequities that far too many women and children of color are experiencing, to front bringing experiments with forced work policies from the Reconstruction era into the 21st century with pushing work requirements and other things in 2017. So I say all this because it has been government's role in law and policy and practice and partnerships and investments that have created and enforced a racial hierarchy and determined based on race who benefits from the idea of help and who is considered a burden when they ask for it. And it has only served to accelerate this enforcement and investment dynamic through its technology practices and choices made. And it's also helped to drive false narratives about the simple idea of who we help that have unfortunately been used to think of the social safety net as simply programs and services to be cut and restricted, rather than as institutional strategies that can protect both poor folks of color and poor white folks from harm. And knowing this is critical to those 2 things that we hold true, and 2 ideas that animate what's underneath those 2 ideas. Knowing that when Thomas Jefferson wrote, "All men are created equal," he meant just men, not women. He meant just white people, not people of color. He meant just people with property, not those without. With that aspiration that Abraham Lincoln laid out in the Gettysburg Address about the transformation of government and a government of the people, by the people, and for the people is still on the table. And so we're having this discussion because without that ability to recognize that these past and present harms, but also the ability of the thing that we need to work with, that really has the power to change people's lives, we run serious risk of complicity in upholding the status quo. And it makes any effort to center equity as an aspiration to being something different a moot point. So now we find ourselves literally and figuratively at a critical juncture. We're all feeling this moral imperative to deal with equity, to be anti-racist. And I think it may be, there's possibly a new role for government to proactively advance a different vision of the idea of how we help each other. And so we're going to talk about that today. And we're going to talk about if it can effectively not just deal with equity, but more specifically race equity. And why that? Because race is almost always on the table, yet rarely discussed with any shared understanding. And more often than not, it's the elephant in the room when we're talking about undoing many of the structures that drove the policy and political choices I just spoke to. It's the soil that public benefits programs that we use to support people have grown from. And it's the region that well-intentioned reforms have made little to no effort at going after programs. So we are going to talk about that, right? In addition to this moral imperative we feel for righting wrongs, there's also a particular urgency in our current moment to integrate and incorporate new frameworks and tools, both due to our our country's changing racial demographics that, California has been experiencing for over 20 years now, and how the pandemic is demonstrating that while we're moving urgently, are we moving urgently enough, giving what the reality of the shifting landscape means? And when I say that, let me just be plain when I say it. California is a majority of color state. And it is largely that because it is truly a state of immigrants. Yet none of that has resulted in any better treatment or any better outcomes for communities of color or immigrant communities. Even as we have become a larger numerical population, our daily lives have not changed. Being the majority has not mattered. And COVID-19 has been a stark reminder of this by laying bare pre-existing conditions of structural inequity. With this constant barrage, we're getting the vivid descriptions and these really evocative pictures of sites of trauma, forcing us to bear witness to the vulnerability of domestic workers and care workers who are largely folks of color, and the disposability of nurses and healthcare workers and other essential workers who are largely from communities of color and immigrant communities. And the pervasive and damaging nature of a pandemic that has disproportionately affected Black and Latinx communities, regardless of age. And this prism of vulnerability that we're seeing that's entrapping Black and Latinx and immigrant women. California is demonstrating that inequitable outcomes don't change with the increase in populations of people of color. And something has to support all of us working together to course correct through thoughtful policy and inclusive policy and programs and services. Something has to drive our systems and institutions and our technology choices that have been used historically to take the simple idea of help and create barriers to opportunity. Something has to help us undergo a transformation in being something different. And that's what we're going to discuss today. And so with that, I want to bring in Anna and Marco, because we've talked about this before, but given all that I've said, those two halves, let me just ask you both what you think. Is a question that many think have an obvious answer, but given all that history and context, for us to achieve real equity, particularly using our safety net programs, our social safety net, do you believe that government is a necessary part of that conversation?
So perhaps I'll start. Can everybody hear me? Robert?
Yeah. Uh-huh.
Okay, great. So LA County has a gigantic footprint across our nearly 5,000 square miles. Residents touch county government when they get a birth certificate, when they go to the park, visit a library, vote, get food assistance, pay taxes, take the bus, call 911, and on. And in LA County and the other 57 counties across the state, these processes are not always easy. There may be long lines, there may be long-standing policies and long-time inequities that really make it hard for people to get the services that they need. And the population that depends on county governments and city governments and the government in general, especially for food and social services, and healthcare, are disproportionately minority. Many are monolingual, many are immigrants, many have lower educational levels. And this status quo that we have all kind of existed in is something that has to change, right? The government has to play a role in recognizing these inequities and doing something about them. And we can do that in lots of different ways, right? Government can look inside ourselves and inside our systems. We can change policy. We can change budgets and allocation of resources. We can hire people of color and promote people of color. We can look at data. And we can ask our diverse population to give us input and make those decisions with people rather than for them. So government has to play this role in ensuring equity. And we can't do it alone, which we will talk about, but we have to do it with our partners, with our faith-based partners, with our community-based organizations, And most of all, we have to, I feel like, have that intention to do so. And if we do so, if we have that intention and we do all of this with policy and budgets and voices in our 88 cities in LA County and all 58 counties, then we may make some traction. And I'll stop there, but at some point, like, I want to talk a little bit about how part of this is also naming the problem. So I'll pass it back over to you, Robert, and to Marco, and then we can get back to a little bit about naming the problem and what that looks like, identifying racism and acknowledging it.
Well, how about we stick there? Because I think that's a good way, you know, Marco, for you to, you know, kind of get into this, because I've heard you talk about this, right? Like, we got to say what it is if we're actually going to change anything. And so what do you think about, you know, that, you know, Anna just kind of put on us, that yes, it's important, and it has to be more than just saying government is important?
Well, first, Robert, thank you for having us, and I'm super stoked to be here with Anna because she's doing the real work on the ground. So I'm just really happy to be here, and I am really proud of, obviously, all of our collaboration. I think Anna brings up some really important points. And I think, you know, to your question earlier around the role of government, I think foundationally government plays a pivotal role. And I think it's at different levels. You know, at the federal and state level, I think it's a lot about system changes, higher level policies. I think the work that Anna does on the ground, it's really the engagement of our local partners, whether it's community-based organizations and others, to really figure out how we better deliver programs and services. The benefit or the uniqueness of California is that we have a decentralized delivery system when it comes to health and human services, right? Some other larger states in the union tend to have a centralized delivery system. The benefit of California is that we have the ability to work with our county partners like LA to really think about how do we deliver programs and services better. I'll say that with the idea that government has a role, but it's not the only role. And I think for us to really address the inequities and disparities that we see, and we've seen them before COVID-19, I think COVID-19 has further exacerbated them, as many of us know. But I think this is a whole of society. This really has to be a whole of society approach, right? It cannot just be government. It has to be the private sector. It has to be philanthropy. It has to be a variety of different entities coming together to say, like, we really got to look at this more holistically. And to your point around, like, really looking at this more sharply, I think part of this is making sure that we collect adequate data to help inform our thinking around what it means. And what I say by that is that we cannot only just say, we know that the problem exists. It's about measuring the problem, informing our work by the data. And the data must be validated by local experience on the ground, because what we can do is collect the information, but the information is as good as the information comes in. And so part of it is making sure that we collect race and ethnicity data, that we collect things around gender identity or sexual orientation, so we have a better sense of how our programs are really serving the people on the ground. And I think that then informs our thinking about the policy changes and the system changes that really drive our ability to disrupt those inequities and disparities. So I'll just summarize that it is the role of government, and we have a large role to play. But I also think that this is a whole of society issue that we must tackle collectively.
And maybe I'll jump in, Robert, with this. Yes, we all have to do this collectively, but we all have to recognize it, and we have to decide together to address it. And I'll just give one little example that I was thinking about. So we are rolling out, as the country is, the COVID vaccine to our population. Our sister agency, the Department of Public Health, is in charge of the rollout and has already seen disparities in who's getting the vaccine, where our Black and Latinx populations are getting it at far lower levels than our white and Asian populations. And that's just in less than a month that we already see that disparity. And so here at the Department of Health Services, we're responsible for our 420,000 patients. And what we are doing is we're sending out emails, robocalls, text messages, newsletters to tell them, hey, this is available. But in that, the most interesting point relevant to this discussion is that we are saying in there, we know there is a history of racist policies in healthcare. We know that racism is wrong. And we also know that Black and brown people have been disproportionately affected by this COVID pandemic, and we need you and want you and invite you to get this vaccine. But government, even a few years ago, I'm not sure that they would say very blatantly, we are racist, like we have a history of racism and we need to change that.
I could dig that. I could dig that. You know, there's something underneath what you both said, though, that there's an imperative of the why now, and it's, you know, and something you just said, Anna, around the vaccines rolling out and failure to deal with this actually makes you ineffective. And so it really does beg the question, you know, what happens if we don't take this moment to really raise people's expectations about how government should be improving equity in general, but racial equity specifically, to actually being effective at doing the things it needs to just do basically today, like logistically just getting needles in people's arms. That if we don't do it, what happens?
Mm-hmm. Well, you know, I'll jump in here. I think shame on us, both at, you know, at various levels of government, if we don't really take this as kind of our wake-up call as a society as a whole, but as government in particular. You know, my boss, Secretary Galley, often tells us that COVID-19 is our greatest accelerant for change. And I honestly do believe that he's right in that statement, in the sense that, like, we have this huge opportunity to really think structurally about what our recovery looks like. And yet, yes, we are continuing to be in active response mode. And yes, we are grappling with all kinds of different pieces with regards to that response. And yes, we have to focus on the various things that Anna just talked about, whether it's vaccine distribution or COVID-19 testing. And I know LA County has done a tremendous amount of work around making sure that testing was more equitable and accessible to people who are disproportionately impacted. And we have done the same at the state level. But I really do think that as we look at the recovery, we've got to systemically look at the programs and services, and we've got to step back and say, do these programs actually fully serve the needs of the people we're trying to serve? Or are they built in a way that they serve the structures and silos of government? And I think too often we build these programs because they're easy to build based on the structures of government and not based on the lives or the ways people live their lives or the needs that they have. So a good example is I have 12 departments and 5 offices within my agency. I have the Medicaid program, I have the CalWorks program, the CalFresh program. There's people who are accessing 5 different programs through 5 different doors. What we don't do a good job of is stepping back and saying, hey, you, Robert Phillips, here are your needs, and we as government are going to wrap ourselves around your needs, and we're going to help you identify what those needs are and look at you holistically from a person perspective. And what I think we've done over the course of the last decade, partly because of the Affordable Care Act and the work to expand health insurance, is we've really looked at ways in which we bridge the gap between health insurance coverage, which used to be this own thing on its own, and social services and the safety net. And what is true today more than ever before is that you cannot achieve the outcomes that we want with providing people with health insurance. You can give someone health insurance, but if they don't have access to a doctor or a provider, or if they don't have food on the table or housing, then all that health insurance coverage really goes away. And those are kind of sunk costs, in my opinion. And so really thinking about our programs post-pandemic and into recovery. And this is a great opportunity for us to think about systemically, how do we change some of those programs to better meet the needs of people we're trying to serve, which Anna pointed out earlier, that they're disproportionately both low income and minorities, African Americans and Latinos.
Yeah, I'll jump. Oh, go ahead, Robert.
No, go ahead, Anna.
Yeah, I'll just jump in with saying that, yes, this isn't new, right? What we're seeing now is not new. It's just underscored by the pandemic and by police violence that kind of put a spotlight on all of this, and the need to, as Marco's talking about, really bring together all of these services to help our most vulnerable folks with everything that they need, from mental health to substance abuse treatment to housing to food, and to do it from that government lens. And there is an urgency to do it right now. I mean, I work for the health department, so that's the area that I know best. But Blacks and Latinos and Latinx have had historically less access to healthcare, worse outcomes across the board, and COVID is no different, and we shouldn't be surprised by that. But this accelerant that Marco talks about and Dr. Mark Daly talks about is going to not only help equalize things and address some of this inequities for racial and ethnic minorities, but I think for across the board, right? For people who are undocumented, people who are poor, people who speak other languages. And one way that's critical to do that is working with community. So one little example from yesterday. So LA County passed Measure J in the fall, and that set aside 10% of our county budget, which is huge. Even 10% is hundreds of millions of dollars of unrestricted money to be able to spend on alternatives to incarceration. And I attended the meeting because I was interested to hear, okay, what are we thinking about? What is this money? How is this money going to be spent? I have a special interest in population that is left out of ACA, and we can talk a little bit about that. But so in this meeting, though, it was fascinating. I mean, there were dozens of people from throughout the community representing people who have addiction issues, people who have mental health issues, nonprofits, advocates, residents with just individual ideas, people from transgender population. And they were all from the justice population talking about ways that we can use this time and right now and the police violence and Black Lives Matter to advance some of these inequities that we have seen for so long, and to bring together all of this and move it forward in a quick way.
You know, that's an excellent point. And there's something implicit in what you all are saying around, you know, kind of pushing in that way. Acknowledging those things also requires kind of calling out the fact that you're even committed to this stuff in the first place. And we got a question, I think, that is squarely on this, which is, you know, how do we get, you know, our government partners and government agencies to be willing to acknowledge these structural questions like you just talked about, like structural racism, like LA Department of Health Services did. Because what it would allow us to do is examine the intentions and motivations of the partners that we work with, as well as the agencies that are, you know, are with us. How do we do that? And if we don't, what are the consequences? Like, can we even do this work if we don't even get that far?
I mean, I think that, you know, from a state level, and I think what Anna referenced earlier with regards to the notice that they sent, where they explicitly noted that, you know, some of these policies have been racist. I think that part of the challenge in government in the past has been that it is terrifying to acknowledge your mistakes. And I think what leadership means within government, whether it's at the federal level, state, or local level, is making an acknowledgement that, yes, we as government do make mistakes. And yes, we want to learn from those mistakes. I think too often we looked at the collection even of data, and this is not, I think we've made tremendous progress here, but the fact that we looked at the collection of data and pointed at the fact that there are disparities, to some people, sometimes that would not have been okay. And so I think what's really important is that we have leaders who create spaces for people within government, first and foremost, to have the ability to have an honest conversation and lift up the issues that we are seeing and be honest with and transparent with the public around some of those issues. We are not perfect, and nor will we ever be perfect. But I think that part of this experiment is iterating on what we are learning. And we have to be able to be honest with ourselves internally to say, yes, there are inequities. Yes, there are disparities. Yes, there are racist policies that are in place, and how do we fix them? At the same time, we have to create tables for our external partners to come to the table and engage with us proactively and productively around how we make changes to those programs. Are we going to make changes across the board all at once in one swoop? Absolutely not. But there are things that we can do incrementally over time in order for us to be able to do it. And part of that is an honest internal reflection of kind of our own mistakes and our ability to hold ourselves accountable, whether it's state, local, or federal government, in order for us to be able to move forward on some of the pieces and some of the things that Anna and folks in LA and other parts of the state are really working on with regards to really addressing. It's easy to talk about this. It's less easy to address it. And testing is a really good example with COVID-19. When we made a commitment early on to really look at equity with regards to testing, that was really difficult because we were targeting organizations who did not know what testing was or how to do it. And so we had to spend, in order for us to make that commitment, it meant that we could not walk away from Black churches and FQHCs and really underserved areas to be able to say, yes, we will make sure that you have the right people, the right supplies, the right marketing to get out into the community and bring folks into testing. It was easy for us to set up a testing site in some other part of the state with partners that could do it. But if we really wanted a commitment to that, we really had to work hard to get going on it.
Yeah, and I think in answer to your question, Robert, that if we don't do something, then we will continue having policies like you brought up in your introduction. And if we don't sustain this. So yeah, testing is a good example. And, you know, for all the damage and death and destruction that COVID has caused, it's also paved the way for these collaborations with Black churches, these collaborations with the community health centers and with small community groups that we are now investing in that are doing some of this work and raising awareness and doing outreach and communicating with these populations. And it's led to things like releasing tens of thousands of people from the jails and more services for people experiencing homelessness and more community health workers on the streets connecting people to social services and easier for people to vote by mail. I mean, all of these things that reduce inequities at every level of local and state government. But it also, I think, takes leadership and really leadership and language, right? People changing the language, changing the dialogue. And I am the first to admit that some of this language is new to me, right? And I am conscious of that as a white woman leading an organization and a program here that serves predominantly the Latino population. I'm always thinking through, like, am I using the right language? Am I addressing the issues that I need to address? Am I including everybody at the table who needs to be included to make these discussions? And the leaders above me, the Dr. Christina Galley, who runs our department, she started an equity and diversion and inclusion committee to really take a hard look. But my hope and slash fear is that our country will, and our state and our local governments will move on, and that these changes that we're starting will not be sustainable, and they just have to be.
And that point, right? And because it is a fear I think a lot of folks have, and I would say a lot of folks of color, right? Including myself, that, you know, everybody wants to be an anti-racist organization now. Everybody wants to be a racial equity organization now, until it's no longer either required or cool. And so, you know, it does beg the question, you know, both of you all spoke to this notion of intent in order to actually get it done within government. But one of the strategies you all talked about here is, you know, partnering with other institutions and communities. Yep. And, you know, kind of keeping the flame lit on that is driven in large part by whether or not you and your partners are kind of in lockstep. And so how does this idea extend to the people you work with, to the people who are doing the delivery, the people who are third-party administrators, people that you contract with, as well as the ones that you need to kind of disseminate something, does this extend to them as well? Like, what if you're working with folks who aren't necessarily aligned? How do you deal with that question? If you have this framework and you are very conscious about the language you use and who you're working with and how you're showing up and acknowledging the history, does that extend to everyone you work with?
Well, I think it has to, and I think Anna would agree with me. I think that part of it is creating a culture within our own organizations as leaders, right? And I referenced to that earlier. In order to sustain this, culture change is really difficult, especially in a bureaucracy such as big as government. And I think that we've got to not be discouraged by the idea that change has got to happen, because the programs that we had, and many of these programs have been around for 10, 15, 20, 30 years. They 30 years ago served a very different population. They were predominantly white, right? Like today, it's a totally different population. And when I ask my team, what have we done in the last 10 to 15 years to make changes? Because when you look at the population is changing drastically, whether it's more Latinos, more African Americans, et cetera. The question often is nothing has changed. And that's the fundamental problem, right? And so part of it is culture change within our organizations to basically be able to say, yes, we've got to look internally around what is happening here. The other thing is we've got to hold our partners to the same standards that we hold ourselves to. And what I mean by partners, it's not just governmental partners, but how we contract and who we contract with and what standards we put on them is equally important, right? And so there's systemic change by just saying, like, when you put out an RFP to make sure that as part of that RFP or RFI that you've got these pieces around how are you looking at the data? How are you looking at inequities? What are you doing to disrupt the disparities? Those are all powerful ways in which we can move the needle and really transform the way we do business moving forward with our partners.
We got a comment and a question on that that I think, speaks exactly to what you're talking about, Marco, which is the comment is, in their experience, government tends to respond to things like this with a new program or initiative, rather than actually dealing with the root causes, which, some of which you laid out even in agency, which is coordination, integration, and access. And then thinking about how you actually just reimagine what we got going on in the first place, rather than doing something new. And so, where do we start with that? Like, how do we approach that?
So that's you make a really good point, or the participant, the person making the comment makes a really good point. We react, right? So here's another example. We are through the pandemic, we as an institution and institutions across the country have had to switch to telehealth. And because people aren't coming into health clinics as much, right? They're being told to stay home. So we had to switch to telehealth. But you can't just assume in developing a new telehealth program that everybody is going to have access to broadband, that they're going to have access to Wi-Fi, that they're even going to have not anything but a flip phone, if that, right? So you have to, from the very beginning, you have to think through these things. And what does creating a telehealth program, is it just going to further drive that inequity, or is it actually going to address it? And it goes to education too, right? Like in my household, my kids each had a computer, we have good Wi-Fi, like they have no problem doing online school. I can work from home a lot of the time. This is, they're teenagers, they can handle it, but not everybody is as fortunate. And we have to look at all of that from instead of being reactive, be really proactive and think through all of that from the very beginning, and think through again how we roll out programs and and the policies behind those programs.
Just to build off of what Anna just said, I think that one of the things that we are focused on here at the Health and Human Services Agency at the state level is really thinking about how do we adapt our programs to meet the needs of people. Our motto is person-centered, data-driven. And person-centered comes from the health space often, right? Like you want to create a person, but it applies on the human services side as well. And so I think one of the things that we're focused on is really looking at how do we meld together all of the data that we have around the people we're trying to serve in the siloed programs to better understand on the cross-cutting piece, what does the population really look like? So I might have a person or a group of people, and I'll give you an example in just a moment, that touch multiple programs within our agency. What are their needs? How do we adapt the programs to address their needs? How do we holistically wrap ourselves around them? One particular population that I'm and my colleagues are particularly focused on is high needs kids. And these are kids who are in the foster care system, they're on Medicaid, they might be getting developmental services from a regional center, they're getting special ed from, Department of Education. In any of these cases, there might be a small proportion of individuals, but they are a large consumers of our programs. And so we need to think about how we serve them. It is almost similar to when we think about the health side around dual eligible individuals who are both on Medicaid and Medicare. There's a small proportion of the caseload when you look at it, but a really high proportion of the cost that we accrue on them. And that's not to say that we shouldn't be accruing the cost. It's just that we're accruing the cost because the system is so fragmented and dysfunctional. And so that is why we're accruing those costs on them. So I think for us, it's intentionally pulling together the administrative and clinical data to paint a better picture around the people so we understand how do we adapt those programs over time to better meet the needs of the individuals, to be more person-centered and to be more data-driven as an organization.
No, that
and
makes
talking
sense.
to each other. And it starts with different departments talking to each other. It starts with us talking at the Department of Health Services, talking to the Department of Mental Health, and talking to the Department of Public Health, which provides substance abuse disorder services, and coming up with ways that the three sister agencies here in LA County can work on behalf of individuals and bring services to them, like not expecting them to go to big, tall, concrete government buildings in the middle of LA that maybe you have to drive to, that you really bringing it to the streets, to people's homes, to the community clinics, to the churches where people are.
Yeah, I think, oh, sorry, go ahead, Robert.
No, go ahead, Marco.
No, I mean, I think Anna brings up a really good point. I think we need to meet people where they are. And this is something that I think we do such a poor job of. And I think we've done better, but I think we can do a lot more. And I think the COVID-19 experience has really shaped our ability to figure out how do we get outside of the four walls of government and really think about how we get closer into the community. And we've got it. The only way we're going to do that is if we partner up with organizations who are trusted messengers and who people are familiar with. Because people aren't going to trust government, right? Like they're going to trust the people, whether it's their church or their nonprofit that they volunteer for, or the local food bank. That is the place where they're going to trust the information, and we've got to capitalize on that in order to make concrete steps in the right direction.
And there's something underneath that both of you are saying. It's not just kind of the expectation setting, right? And being more thoughtful rather than reactive. It's also what's success. That's kind of fundamental to what you all are saying, which is how do we change, what we mean by success to match our intention. And I know we talk about metrics and performance indicators, but how do we really move to reflect whether or not we're actually prioritizing equity and not just the outcomes that people have, but the systems that are driving those outcomes for them to, like you just talked about, Marco, it has to extend, right, to the expectation to the partners.
I think we have to hold ourselves accountable. One of the things that we have in the governor's budget that's before the legislature right now is kind of an equity package that looks at kind of the totality of our work across different departments. So to Anna's point earlier, it's not just about one department doing good work. It's about multiple departments and talking to each other to deliver on the promise of their programs. And so what we're trying to do is say, how do we create an equity dashboard to hold ourselves accountable to make sure that we're moving the needle and are public about the various programs across our agency? What are we doing to create kind of training programs for our own staff to address racial individual biases, to make sure that our programs are looking at that? And it's important for our team to have that training, because I think it helps us move the needle on some of these pieces. What are we doing about language access policy? We don't have a standardized language access policy across our agency, right? We have statutory requirements or federal requirements around threshold languages for some programs, but not all. And so one of the things that we're working on is like, what is the floor? What is the basic that we expect of every program within our agency around language access? That is an important component. Accessibility is equally important, right? And so I think all of those things, like we have to hold ourselves accountable, and we've got to be transparent. And I think we've got to put it out there, and then we expect both the legislature, at least on my part, as well as our community stakeholders, to say, like, you guys are not moving the needle on these things. And being transparent and putting the data out there is one step in that direction.
No, I think that's exactly right. You know, there was a question asked, you know, that was prompted by what you just said, Marco, around, you know, I'm curious just about any examples of when government at any level has reduced or eliminated an inequity that's come out of this policy history that we've had. And, you know, and I don't think, I wouldn't not purport to say that it's done, so I won't put this weight on it, but I would say it's headed in this direction is, you know, the program that you run, you know, My Health LA, right? You know, which is one where a county has recognized that there's a population that it serves that isn't served by anybody else, so it's going to invest in.
Right. Right. I mean, I tell my staff all the time that I wish our program never existed. And I hope that we will work ourselves out of a job, because our program serves those who are left out of the health insurance system and the health coverage system. So the Affordable Care Act extended eligibility for Medi-Cal to single childless adults. It expanded the income so that more people could receive it. And then the state took another step. The state took the step to extend full scope Medi-Cal or Medicaid to children, and most recently last year to young adults. But there is still a huge population of undocumented immigrants that do not have access to health coverage if they don't get it through their jobs, which many of them don't. We don't ask documentation status of our participants because we don't want them to fear. Even when the public charge debate came up, we saw a decline in enrollment because people were fearful of the impact of public charge on their futures and their families. But our program, you're right, is an example. It helps pay for health coverage, primary care, really essential primary care to keep people out of the emergency room for people who can't maybe get it otherwise. And it pays our community clinics, our community health centers across LA County, all the way from Venice to Pomona to the high desert to Long Beach, and to help so they can get that care at the community clinics where they love and trust. And their providers. And so I do think it's a step in the right direction, that this program that was started many years ago, but it doesn't go far enough. And it's also, even within our program, we think about how can we involve our participants more so that they have a say? How can we ensure language access? We produce all of our materials in Spanish, many of them in Asian languages, but then I think there are lots of people from Guatemala and elsewhere that speak dialects. Like, I'm not producing our materials in different dialects. And so how do we ensure that those people have the same access to what they need to know as everybody else in the program? So thank you for bringing up My Health LA.
I love what you just said around we want to work ourselves out of a job. I mean, I think that fundamentally is all of our work, and I think it underpins where we need to go. Robert, I saw a question in the queue around technology and just information, and I think I can't agree more. You go to a government website, it is utterly bureaucratic. It is difficult to navigate. You know, I think one of the things that we are trying to work on is really figuring out how we standardize and become more modernized, not only in the technology that we use, right? Many of our systems are outdated, and the way they communicate with people is not the 21st century. And so really thinking more proactively about how how is it that we're communicating with our clients? A prime example is, we run the CalFresh program, which is the food assistance program, which is called SNAP at the federal level. And, a couple of years ago, there was an issue with the program. And I said, how are we communicating? How are we going to communicate out that there is a problem and people are not going to get the benefit? And the response was snail mail. We're going to send letters out. And I thought to myself, like, how in the world are we in the 21st century and we're sending snail mail letters to people about a benefit when they could be going to the ATM or going to the grocery store and they're going to basically hit a decline? We've got to change how we do business and how we interact with people in government, or we're just going to fall behind. And so I think the benefit of being in California is that we have Silicon Valley, we've got the tech industry, but we also, I think, need to think about not just that, it's how do we engage, to Anna's point, with the consumer to find out how it is best for us to communicate with them, whether that is text message, whether that is email, whether that is regular phone, like a robocall, right? So I think we've got to think about that provision. And I think one of the participants who put that in is right on. We do a really crappy job around kind of informing people and providing information. It's boring, it's bureaucratic, the language sucks. The language just does not meet the language that people really know, right? It's legal language. I always love when the lawyers edit a document that goes out and I say, what does this mean? Like, an average person on the street would never know what this means. How do we really think about translating this into something that people really understand?
Yeah, that's such a, I'm sorry, let me just jump in there, because this is, for the past 5 months, I've been filling in as the DHS Director of Communications for our department. And this is what I've been doing. All of it is communicating. You guys aren't speaking a clear language. We have to communicate clearly with people in a way they can understand. And we have to, relying on my previous profession, we have to rely on the media. We have to rely on ethnic media and local radio stations where people are listening to, and La Opinión and Telemundo and these, ethnic media that people really do rely on. And everything else that you're talking about, Marco and Robert, as a way to reach people. And so the changes that we are making, to kind of bring it full circle, the changes that we are making around equity and reducing inequities are made known to the people that we are serving as government agencies.
I think that's exactly right.
And I think some of your folks put in the chat around federal requirements. I'm stoked that we've got a new federal administration. I am so tired of being reactive to crazy policies that are ill-founded. And, we spent the last 4 years, Anna mentioned public charge. I mean, we spent the last 4 years fighting like hell to make sure that we are protecting people and making sure that, we didn't do harm and damage. I am just relieved to the idea that we can actually think proactively about how we actually improve some of these programs. And so I think it's upon all of us to work together with the federal administration to really think about changes that we can make. The same is true for us at the state level. There are things we can change at the state level, we must. But I think it's exciting that we have a new federal administration, and I'm stoked that we can actually be proactive rather than reactive for once.
I absolutely agree. So we have 2 minutes left. So I want to ask a question, and hopefully I'm not starting a long answer. But, in this conversation with government, there's always this question around, what's the right place to start to really kind of get some momentum behind the work, right, and the strategies. And, I've always thought that the retail part of government, the social safety net, right, the part of government that touches folks every day, is a way to not just raise people's expectation about government's contribution to equity, but a really core way to kind of get into the question in a demonstrable, but also in that type of feedback loop way that you're talking. And so I'm just curious, do you all agree or disagree with that?
I mean, I think to me, it starts with healthcare. So it's part of the social services, right? It starts with health, because health affects everybody. And, we only run the kind of public hospitals, public clinics, but our safety net extends well beyond that. And with a third of Californians and half of children on Medi-Cal, people are seeking care out at the safety net. And so if we can make changes to make things more accessible through healthcare, I think that's a good place to start. I also think just agreeing on some basic principles around this, around collaboration and transparency and equity and commitment and sustainability across the system is a good place to start.
I just to add on, I think it's both on the ground, people really pushing at the program level, at the client level around changes that folks want to see. But then it's also from the top, like we've got to demand better and more from our leaders, right, to address these things. Because if we don't have that leadership at the top and also that that push from the bottom, we're not going to be able to deliver on this. So this has really got to come from both levels in order for us to see concrete change. And we need to demand that the public hold us as government leaders accountable. And we cannot be afraid of being held accountable. We're not going to be perfect. We're not going to get things right. But I think we've got to iterate. And iteration, and in the technology space, everyone talks about agile, which drives me crazy. Like it's such weird lingo. But iterating is a really important piece, because I think you iterate on the concept. What we try to do in government is create programs, and we don't release them until they're utterly perfect. What we need to do is create programs, put them out there, and then iterate with people as we go, build on them, make them better. That's how we're going to deliver the best possible product for the person in the end.
That's what's up. Thank you both. Thank you both for making
My
time and being willing to talk about this with us. And thank you all, everyone who joined us. And know that this, is just a teaser of a larger conversation that we have to have, and that will be an ongoing one. And thank you all for participating today. You all have a wonderful day.
Thanks, Paul.
Thank you, Robert. Thank you, Anna. It's great talking to both of you.
Thank you.